or the pointer?
Here's the pointer. Voila, it should work.
Maybe I should be pointing it elsewhere. Hi everyone, welcome to the People's Cafe. Let's get started. We'll open the door at the back, so the newcomers will keep trickling in from that side. My name is Amandeep Singh Gill. I'll be your host this evening. I lead the project on the International Digital Health and AI Research Collaborative out of Geneva. You'll hear a little more about the project from me shortly. And then I'll be joined by some fantastic panelists here on stage to talk about digital health from different perspectives. The focus today largely is on multi-stakeholder partnerships. Our takeaway at the end of the evening should be not just to get to know this project better. This is our first introduction at Davos on this subject, but also hopefully to get some feedback from you and to get ideas about partnerships and implementation. And then when we come back next year, we have a plan for coming back on one of the specific projects that we are doing. Then we hope to see you back again to in a sense look at how we made progress and how we are doing and how your feedback and thoughts have been reflected in our work. The idea of the initiative comes from the report of the UN Secretary General's high-level panel on digital cooperation, which was co-chaired by Jack Ma and Melinda Gates. And in the recommendations, the very first set of recommendations focuses on going beyond connectivity, going beyond simply wiring everyone up to digital networks, to creating demand at the base of the pyramid, inclusive demand for digitally enabled services. And the two areas that the panel chose to highlight were inclusive finance and health. And these are potentially the most transformative when it comes to moving the needle on the sustainable development goals. And after all, we are in the SDGs tent, and that's what really unites us different stakeholders on the way forward. Now, how do you create inclusive demand at the base of the pyramid? The ideas inside the panel were clustered around this notion of digital public goods. So the experiences of India, China, Africa, and other countries on deploying digital technologies for development tells you that you need to create these common rails for scaling the use of digital solutions. And these common rails have to be combined with guardrails, which provide the governance, the protection when you start scaling these technologies. And creating these public goods would require new approaches to collaboration. And this is really our main focus, that we need to create new kinds of collaboration around the next generation of digital public goods. There is policy receptivity to the opportunity that the panel highlighted. Many countries are embarking on significant digital health initiatives, And then there is a new momentum at the World Health Organization, which has created the post of a chief scientist, and under her, a new division on digital health. And I-DAIR, from the beginning, has worked closely with the WHO on defining its value add, defining its approach to solving the universal health coverage problem. Naturally, there's no one entity that can address all these challenges. The challenge of fragmentation of data, lack of interoperability, the poor quality of data sets, concerns on data security, legitimate concerns, the duplication and waste that we see in the research and development effort. And then finally, what is most important in the health domain is that you have a lot of in silico solutions that really don't work in the field. So we have an example from a country in Africa where there are 60 plus digital solutions, but only one has actually been benchmarked on the ground. So this is a recurring problem, and you can, if you don't address this fast enough, you could have a deluge of poorly assessed solutions that create further headaches for public health authorities through the wrong kind of nudges, rather than helping solve the address the existing burden of public health issues. And finally, something that's very important, not enough thought has been given to engaging youth, particularly in the emerging geographies of innovation. This aspect drives us deeply. We want to work not just in the sense of protection and prevention, but also access and the opportunity aspect. The digital natives can really contribute to the innovation that's needed for scaling digital health solutions. Now, this is the concept and the value add that we've defined through 4 months of consultations, starting in September. Essentially, what we are creating through I-DAIR is a neutral, trusted platform that enables collaborations globally, that enables collaborations and addresses critical concerns and acts as a kind of brains trust on problem solving. The approach is not to create a new international organization or a secretariat of the kind that you often see from the 20th century type of approaches to solving these problems, but to have a hubs and spokes model that brings these innovative, youthful geographies closer for experience sharing and scaling. And this way, the I-DAIR initiative can shape the emerging data infrastructures in these countries as well, and allow the younger researchers from countries such as Tanzania and India to be part of the global problem solving on these issues. We have some ideas about what kind of a role I-DAIR could play on data interoperability, and I'll come to that in a bit. In parallel to the platform building, to constructing the partnerships and the infrastructure that's needed to sustain I-DAIR, we are focusing on 10 pathfinders. So these are the ones that will give us the meta learnings that's required to take I-DAIR to the next stage. This is our link with the practice of digital health. This is our link, our focus on the practice-driven governance of data and practice-driven governance of AI. So if you look at the first one, the global research map, the idea is to create a situational, better situational awareness for funders, investors, so that they don't duplicate R&D dollars, and they can see collaboration opportunities. This is a tool that we would like to maintain on an iterative basis, and this is in fact what we would like to bring back to Davos next year in a draft form. This is something that we'll develop not just in collaboration with governments, but also the private sector and academia. Then we have real-time epidemiology with a focus on 4 or 5 disease conditions and dashboards which help decision makers visualize developing situations such as the one we see now with the corona virus. This is a problem that's been looked at for a while. What we would like to bring to this is a fresh focus on the merging of real-time data streams, not just social media type of data streams, but other kinds of data streams to generate better insights and bring in more predictive power. On the Pathfinder on digital innovations in health systems, we would like through 6 or 7 case studies to look at the future of care platforms. So how does patient triage, emergency room management happen in the future? What kind of diagnostic networks would come together to help physicians diagnose problems better, and how could models sit on top of those diagnostic networks to generate the kind of insights that both public health sector and private companies need for deploying the next generation of digital health solutions. We have a Pathfinder that'll be looking at creating a responsible ecosystem for the private sector. So instead of a race to the bottom, we want to encourage a race to the top, a competitive race to the top, where through a set of challenges, prizes, we create an ecosystem for moving up the levels of responsibility in this space. This ecosystem would also have tools that smaller companies, startups can use. For example, the starting data sets that they might need for addressing specific problems, or cleaning tools that they can use to clean legacy data. The competition that we're thinking of in this space include competitions such as best alignment of public and private data sets for digital health solutions. So a young company could aspire to win that prize, and that in a sense takes the whole system up another level of responsibility. The governance Pathfinder, we will leave aside for the first year, given that WHO is going through its own thinking on data governance, and given that the Lancet Commission, which we are closely aligned with, is underway. So we'll wait for the first set of insights to emerge from that before embarking on our exploration in this area. And these Pathfinders are supposed to generate these meta-learning. So there's value within each Pathfinder in addressing specific issues like mental health, but there's values across the Pathfinders on how do we bring together different collaborators, how do we address the open science versus closed IP dynamic in the health area, how do we improve data interoperability, what kind of data architectures are needed for the future. And our approach is, our idea in the data interoperability Pathfinder is to come up with 3 models, not one silver bullet, but 3 models that could be used, for example, in a setting where there's a heavy legacy of existing data sets, in a setting where there's a mixed kind of an experience between legacy and emerging data sets, and a clean slate approach where you have much more freedom in architecturing these systems. And obviously, data protection related insights would be a valuable part of the meta-learning. And this meta-learning would be showcased at the time of launch in late 2021. I just wanted to put up an example of a couple of the Pathfinders that would be of interest to this particular audience. So in the global research map, we want to create potentially a basement for a World Health Assembly policy discussion in 2020, 21-22, so that over a period of time this can be maintained in an iterative fashion through the WHO. And this would involve knowledge partners from the private sector. You know, we have two companies with whom we are discussing this, and academia. And in that sector, we are talking to an academic publisher. So there is this literature survey type of an aspect, which I think that partner would bring into this. But I want to emphasize that this is something like a live tool. So it'll be nourished by consultations that are based out there in the regions. So it's not a Geneva-centric type of an aggregation, but it's more nuanced in terms of what is happening out there in the field. So these are some details of the ecosystem for private companies. There is a benchmarks related aspect of it, which perhaps we can take up in the question and answer discussion session. Let me just wrap up with a slide on the high-level timeline. So we are currently in phase 1, which is the ideation and sustainability phase. We would be moving in summer this year to a phase in which we load the pathfinders, which we start the projects in the pathfinders set of 10. And then when we come to launch, that's the time when we showcase and scale the successful pathfinders and start harvesting the first set of public goods on data governance and data architectures. We also hope at that stage to launch capacity building projects and youth challenges around data for health. So as you can see, there is the platform timeline. In parallel, there is a timeline for the pathfinders. So I'll stop here and I'll invite the other panelists to join me on stage. Louise, please, and Philippe. Please join me on stage, and we'll move to the next stage of our discussion. We have another panelist who's running a little late, Anir from Bangladesh, and he'll join us shortly at 5:30. So maybe what I can do is just pass you the mic so that you can introduce yourself briefly to this audience. And just want to check once before passing the mic on. At the back, can you hear us well? Okay. No?
One, two, this one works too. So maybe you hold it closer to your mouth.
Hi everyone, I have a loud voice, so hopefully you can hear me. Yeah, the guy at the back saying thumbs up. So I'm Louise James. I work at Accenture and I run our not-for-profit consulting group called Accenture Development Partnerships. And we'll come on to it, but we do a lot of work in cross-sector partnerships and a lot of work around health, hence why I was invited today.
Thank you, Louise.
Hi, I am Anne Arts. I'm heading the Novartis Foundation, and we also work always all over our work on the ground is in multi-sector stakeholder partnerships, and also everything we do is underpinned with data, digital, and AI, and that's why we are passionate about this today.
Good evening. I'm from Kenya. We have to greet people. Good evening. My name is Philip. My name is Philip Tigo. I am supposed to eat the mic. Okay. So, my name is Philip Tigo. I'm Senior Advisor on Data, Innovation, and Open Government in the Presidency of the Republic of Kenya. My role, basically, as you know, is data innovation. I've been part of putting together global partnerships. We were the first to put up a global partnership on sustainable development data at the launch of SDGs 5 years ago. We've put another collaborative on using Earth observations with Amandeep on the World Economic Forum, Council on Global Public Goods for the Fourth Industrial Revolution. Yeah, so that's among the little things that I do.
Thank you very much, Philip. I would also like to introduce a few people in the room from the I-DAIR team, I-DAIR fraternity. From our two funding partners, support partners, GESDA and Botnar, we have Dr. Aline Kossi-Gartner, Chief Learning Officer from Botnar, and from the Geneva Science and Diplomacy Anticipator Foundation, we have Dr. Martin Muller there at the back, and Daria Robinson, who's in fact responsible for putting this together. From the I-DAIR team, we have Martha Jennings here. She's in charge of private sector partnerships. And Akarsh, where are you? There you are. He's in charge of our interface with international organizations and institutions from around the world. So let's get the discussion started, and perhaps I can turn to you, Louise, first. So what do you think is the private sector interested in the digital health space? You know, from your perch, which covers the commercial side and the non-profit side.
So I guess my brief answer would be, what are they not interested in? I mean, if you think about digital disruption, right, it's affecting all industries. But from the research that we've done, we know that 41% of health executives are saying that AI is actually going to be the biggest thing that's going to disrupt their business over the next few years. So, you know, from a private sector standpoint, the urgency is there. We're seeing the disruption, and executives are thinking, how do I adapt my business model to be fit for purpose in a digital world? So, you know, there's definitely the need there. They see how fast the opportunities are moving. And actually, when we look at things like the rise of Internet of Things, the rise of wearables, these huge data sets that are now emerging, the potential for the machine learning then to tap into those and provide new digital health solutions, you know, the possibilities are unlimited, right, and moving very quickly. And what's fantastic from our point of view, because as I mentioned, I run our not-for-profit consulting group. So actually my clients are civil society organizations, donors and foundations, and we try and bridge between the advice and consulting that we're doing with life sciences companies with the work that my team is doing on social issues and environmental issues with civil society. And it's fascinating to bring those two sides together, because as we always say, right, if we think about the SDGs, no one sector can solve this alone. And so I know one of the things that Dario asked me to mention was the challenge of partnerships, because the private sector recognizes it needs to partner, but we all know that that's not always so easy. And so maybe I'll come on to it in a bit, but you know, we have lots of thoughts around what it takes to make a good partnership.
Right. Thanks, Louise. So one thing that we need to get right is the partnerships, the multi-stakeholder partnerships around digital health. So from the perspective of a foundation based in Basel, where a lot of successful pharma companies, the last generation of health, in a sense, champions, I mean, through the traditional ways of doing medicine are based. So how do you see that shift from that perspective, again, from a foundational lens and also from a shifting commercial landscape lens?
Thank you, Amandeep. Yes, we are truly a believer that with the global health challenges we have today in the world, they have changed so much and they are unprecedented with this triple burden of disease. It's not all about infectious disease anymore, but it's the real enormous burden of chronic diseases and obesity that is really overwhelming health systems around the world. So with that changed global health challenge, we need to change the way we deliver health and care around the world as well. And we see that data and digital and AI now will be the opportunity we have. We live in a digital era, so we have to deliver health and care in that digital era and make use of those opportunities. Now, the low and middle income countries have the highest need or the highest benefit they can reap from working with these new technologies and using them and even leapfrogging them. That they don't have to test it again or make the same mistakes as high income countries did. But they also have the biggest risk of being left behind, and we really have to look at that. We don't want that to happen. So we need to make a call for action for all the leaders in the world, that they are visionary enough and build a vision. What are the health problems they want to address with data and AI? What are their priorities they want to digitize, and then invest in both the infrastructure and the capabilities. Because what we see on the ground is infrastructure alone, and that I also see through our work in the Broadband Commission for Sustainable Development, where we had our meeting yesterday. It's not enough to only bring the infrastructure. You also need to make sure it can be used on the ground, that the demand is there, and that you have the capabilities to develop wonderful AI solutions with local data. So all the challenges that go with that are very important, have to be addressed, and are not going to be simple to be addressed. But we have to work together with the different stakeholders. And I'm a big fan of multi-sector stakeholder partnerships. Same in governments. We see if governments talk to each other, if the Minister of Health talks to the Minister of IT, digital health becomes realized in a country. If the Minister of Health doesn't do that, they don't know of what a solution can help for their health problems, or they end up with a fragmented landscape of several problems, solutions, I mean, that don't even respond to the priority health problems. So these are the situations we have to remediate in low and middle income countries by working together, but leaving the policymakers in the driver's seat. And that is hard for private sector companies to really get used to that way of working. We have to leave the governments deciding what their priorities are they want to address with data and AI, and not come with the beautiful solution and impose that. That's the wrong way around. We've seen it through every partnership we have around the world, whether it's in urban health or whether it's to eliminate the oldest disease on earth, leprosy. It has to be with the local partners have to be in the driver's seat. So that's one success factor I can already tell about partnerships. There's many more.
Excellent, Philippe. So leaving policymakers in the driver's seat, and how do you see that from one of the driver's seats in Kenya?
So as I said, I have a very interesting role, and my role is really on data innovation and open government. I'm not in a very specific sector. I was hired simply because of our government understanding that, and I don't talk sector, I talk systems, because sectors from the policy perspective are often a problem, because they pigeonhole you and you put you in a silo. So the first thing, for example, how we look at it is, one is when everything fails, it becomes a health problem. So I never like to talk about health because it just tells me how we continue to fail. You eat too much, obesity, problem. You have not enough food, malnutrition, it's a problem. Who here visits a hospital? You just went to a hospital because you like it. Nobody goes there. You only go to a hospital when everything fails. So that's how we see it. So it means all the other systems must work. This is a symptom of failure of the other systems. So that's basically how we see it. The other bit, of course, I think for me is, when we talk about private sector, is that, and everybody, the beauty about Kenya is that everybody comes to us, whether it's Google, Facebook, everybody. But you send us the wrong people, right? So for me, that's what I always say. I need the right person from that organization to have a conversation with. In most cases, I get a salesperson or a marketer. I need somebody who understands systems, not technology. Technology is just tools. So I think for me, that has always been a problem where, and we've seen these partnerships. The problem is that you have the wrong person who's leading this partnership. But if you had somebody who simply understood the issues and systems, then they could better understand what part of the company or technologies within that organization then can be better deployed over time, so that we can create the incentives to enable that company, yes, deliver public good, but then make profit. Of course, public sector understands private sector have to make money. The other bit, of course, is nobody wants to deal with the gaps. Every time we talk about AI, I mean, we have huge data gaps. I just had a conversation. I mean, the minute I got this job, that's the first thing I looked at. Where's the data? What data do we have? What are the gaps? We have huge data gaps, simply because we have so many providers within the systems. Within the health system alone, in a country like Kenya, 60% is private provided. And the private provision is not private, it's private faith-based, it's NGO, it's everybody else. Only 40% is government, and even then there are different tiers of that. So there are many people doing many things, so you have issues of interoperability, and that's where partnership fails. If you don't have a common language, and if everything is about supply-driven, then how do you begin to roll this back to have a real conversation around what are the needs, how do we build resiliency, and that. So I think for me, even the issue of a common language of what a partner is, even to dumb it down into that. And that's why for me, I advocate a lot for translators. Translators. Today, if you come to us and talk about AI, we'll not tell you we don't know what AI is. We'll just nod and smile because we are nice people. But after that, I will not follow up, and this will not work. So how do we even get translators who, yes, you're excited about AI, but then come to my colleagues and dumb me down a bit and say, listen, this is what it actually means. Not the technology, not interested in what is under the hood. What is the impact of what you want to deploy? I think for me, those are the quick kind of pieces I want to mention. The other bit, of course, is resiliency. Governments always think long term. A lot of partners we have are short term, project-based partnerships. I would chase you away without a blink of an eye. I mean, that's my job. The minute you mention project, I'll switch off. And I always tell people who come to me, the minute I drop my pen, it's kind of your time to leave. Because the minute you say project, I will shut down. What has been happening, especially in countries like mine, is that a lot of health system strengthening has been project-based. 3-year, 4-year shutdown. Again, 3-year, 4-year shutdown. The thing about this, and it has to be an interest of private sector, because you are in a country for posterity. Private companies are not there for projects. You're there because these are relationships you're building even with stakeholders. I think for me, that's also the other bit. Think long-term, think resiliency, and let's create value.
Absolutely. Fantastic. So the missing data issues, missing data, wrong people, not having enough systems thinking, not having enough domain translators, interpreters, and resilience. Now, circling back to where we were, the need to build strong partnerships, you see that as a dawning realization in the private sector. But what are the other challenges you see which need to be addressed to get the kind of partnerships that Philippe and Anne were talking about, the dream partnerships around data for health, around AI for health? What are the problems we need to solve?
Well, I think actually, Philip, what you talked about touched on a key point about it's not about the technology, it's about the issue we're trying to solve, right? And I think if I look at the way that we're working with clients, it's very much focused on being issue-led, right? And taking human-centered design approaches and really working, having an agile process, which is working with our clients to say, you know, what are the issues? What are the potential solutions? Very quickly prototyping it and making decisions to kill things quickly and killing the critical things fast. Pivoting, right, learning from that, and then redesigning, and then if you find, be prepared to kill again. So it's really an iterative cycle until you get to the point where, okay, is there something which we actually think is going to meet the issues? And then we look to scale it. So if I look at the methodologies that we've instilled in our, you know, we have 500,000 employees around the world. We're really focused on this concept of agility, this concept of being issue-led and really thinking always about testing and prototyping. So one example of that, which was just someone was telling me the other day, was very simple around the use of a chatbot. And this big insurance company was thinking about, thinking, oh, we must have a chatbot. Everyone has a chatbot. But actually, instead of, developing a chatbot and trying it out, they actually just developed the first front end of it, and they'd had people simulate as if they were a chatbot to see whether they were actually going to get the solutions and answers that they needed. So they didn't need to invest a huge amount of money in building a big infrastructure. They were just testing it out and saying, is it solving the issue we're trying to address? So I think for me, that's an absolutely, critical thing. And then really about the partnerships, I mean, I totally agree with so many points that was said around, the need for being very clear around the objectives of why people are coming to the table, and realizing that it's not about everybody coming to the table and all sharing the same objectives. You're going to have different objectives and be transparent about those. But then actually moving forward, saying this is what we think we can get out of it. This is what we want to get out of it. And is there enough common glue, right, to bind that together? And not partnering for partners' sake, because we're saying we love partnerships. I mean, my grey hair is definitely from the partnerships I've worked on. It's not easy, we know that, and sometimes people think, oh, let's bring all these partners in. Actually, I would say try and really think carefully about who you really need at the table, and don't bring in a whole load of other people, because that's only going to add complexity.
So managing complexity. And this point, Anne, about going beyond projects or boutique approaches to a larger systems approach. What's been your experience of thinking beyond the 3 or 5 year horizon of a project?
Well, our experience is absolutely, that's what you said is absolutely true. You have to think long term. We feel very often policymakers don't think long term enough. So it's the opposite what you say, but it's a balance. Most probably we are both right that there's both sides of it. But I firmly believe we have to think about how we are going to roll out, in what kind of systems we roll out solutions to address the issues we try to address. And you need to really nurture ecosystems to be able to do so. And that is going to be the biggest hurdle for making countries realize the benefits of AI in health, to roll it out in ecosystems that are there for using the solutions that are developed with the local data, besides having the issues of data interoperability, quality, security, and everything else. But a second point I would like to make is, with the research we do together with Accenture and Microsoft for the Broadband Commission Working Group on AI in Global Health, we've seen that last years we've seen always buzzwords about AI in health, but now there's really big use cases out there that are efficiently changing and impacting people's life, and we should look at those. One that comes to mind, for example, 300 million users. Ping An Doctor is providing a comprehensive AI-powered solution for families in China, that they all get a doctor, they all get an electronic health record, and they all get a health management plan. And that is trained by connecting with 2,000 health systems in Asia. I mean, this is not nothing. We should look at how that is working. It does work. It disrupts the way healthcare is delivered because it's working in virtually. It's working next to the health system. And there's many other use cases like that around that are already impacting lives of many people. So I think we should also look at what is out there, not only what are the hurdles of challenges and challenges of partnerships, but which are the use cases that have been hugely successful and are ready for replication in other geographies. We are currently looking at replicating a wonderful solution from Mexico and bringing it to Rwanda. Let's see if it works. We are working with the governments from both sides, with private sector partners from both sides. Let's see if we can do that. But we also have to really learn from the successes, not only looking at challenges of partnerships. I mean, partnerships, as you say. Gray hair. It's always challenging, but the shared ambitions and the shared objectives also lead to shared glory. And that's the most beautiful part of a partnership.
Excellent. Thanks, Anne. And Philippe, Anne mentioned that you can take solutions that have worked well in one setting to another. And you mentioned in your remarks earlier the need for translation. So is there some translation science, implementation science involved in scaling or replicating solutions that have worked in a particular setting and at a particular scale? And if you can also reflect a bit on, given our common interest in global public goods, what are the kind of public goods we need to create for that kind of scaling and replication to happen?
I think I'm not averse to that. I think for me, and this is, I think, a conversation I was having with Kat behind there. I think for me, the issue is sequencing. Is how do you sequence a lot of these things? I think a lot of people come to Kenya to learn how we do our fintech, how we've rolled out our mobile money, but it's not worked when they try to replicate it in their countries, right? And I always try to tell people that people are looking at the innovation. They're not looking at the process within which how we came through that innovation. And for me, it's always simple. One is that we had a large population that was unbanked. We didn't have, a huge population didn't have banks, didn't have bank accounts, but then we had a larger population that had mobile phones, right? We had, then what happened was the company, which was Safaricom, came to the government and said, listen, I think we have this idea of getting a larger population within the financial system. What can we do? What the government did was, listen, this is new to us. We have no idea what you're talking about. You guys are under the Communication Authority. We have central bank that regulates money. Then can we come together and think through this? What the government did was create an environment to test this, right? But interesting enough is that is never replicated. People want to take the mobile money technology, and so that for me is always a lesson that I want to share, is that transfers and exchanges are okay, but then the process is the one that is more important, right? Sometimes you have willing, and this is, and my colleagues, I'm talking to insiders. I always tell people that because I'm inside, governments will never tell you no, or we don't know, right? So when you say you have a solution, they're quick to say, hey, okay, we'll try it. But I think for me, this is why the translation is important. You need further conversations to ask, is this really the need? Secondly is what do we need to sequence so that even if you have that exchange, you already have the building blocks to be able to adopt that innovation or process. That piece is always missing. And in most cases, because of the project mentality of how these things are done, that doesn't happen. That's why for me, the partnerships need also to be very open to bring those players who can also help in those building blocks. And that's why I think for me the public good conversation is interesting. So the work, for example, that we're doing now with as part of the public goods is working on the fourth industrial revolution and cities, right? So for us, of course, we're looking at unemployment and housing as the issue, but we're also looking at the other systems around this that must enable us to handle that. And it's LA and Nairobi, right? LA has homelessness, Nairobi has indecent housing. So we want to exchange the process, not the problems are different, right? So I think for me, that is what we're looking at. So how do we get public sort of affordable materials for building? How does LA look at Nairobi in terms of multi-stakeholder engagement, because we are good in that. So LA is simply borrowing that. We're not borrowing how they build houses. We don't want that. But I want to understand how LA has a mayor's fund that enables private sector and philanthropy to put money for housing. So you know what I mean? So for me, that's experiment we are working on, so that you can borrow little pieces of it that gets you to your destination, and then how do you then deliver a public good out of that?
I like this thing about open partnerships, and this is an invitation for open partnerships in a sense within this discussion. And I'd like to, at this stage, shift gears a bit and call on a couple of people from the audience to speak to this issue. And could I start with Miranda? Hi, Miranda. So can I put you under the spot and help us with with some thoughts on digital health, and how do you see it from the perspective of the Wellcome Trust?
Great. So apologies, I'm a bit late, so I'm not quite sure of the context of where you've got in your discussions. But Amandeep and I have been discussing some time the fact that Wellcome Trust is a big biomedical research funder, fund about $1 billion in research funding every year. We've just allocated $200 million to mental health science over the next 5 years. And one of the core planks of our strategy is to look at exploiting the power of population level data, in particular in relation to youth with anxiety and depression. So one of our ideas is to want to create a new form of data bank, which is formed on a trust model, whereby the individuals who are banking their data control and own the use of that data. It's not controlled or owned by a commercial company or by an academic group. So that's something we're going to be working over feasibility for the next 2 years, and we're really interested in partnering and thinking with this group about how we can agree standards, how we can work together, and how across the field we can agree a way forward for data that is future-proof going forward.
Thank you so much, Miranda. And could I now request Ila to Ila Nurbakhsh, Professor Nurbakhsh from Carnegie Mellon University, to say whatever is on your mind today.
Well, it's my pleasure to be here. It's actually an honor to listen to this conversation. What I care deeply about, and I direct the global situation space over in the Congress Center, is the question of how we can use visualizations of massive spatiotemporal data across many dimensions of data to change people's minds and move them from doubt to wonder about the veracity of data, to put them in common ground where they can concern themselves more with how we find solutions together. And in fact, if I think about mental health, we had a mental health presentation yesterday that looked at green space and the impact it has on mental health. The visual evidence was undeniable. And it was that kind of evidence that I believe can move people's hearts and align their emotions and their empathy with their brains. So I believe in this project, an absolutely critical part of the Pathfinders will in fact be being able to visualize in a multilingual way exactly why we're having real impact on the ground. And that's perhaps a way of getting over this wicked problem challenge that so beautifully was talked about with Francis, because you cannot move a solution from place one to place two. You have to move process, you have to move empathy and compassion from place one to place two. And that is the real challenge that we face, is to stop being engineers and start being cultural theorists.
Great. So bringing more cultural issues, anthropology into engineering. So can I turn to another engineer in the room? Ramesh, would you like to say a few words, please? And Ila, could you pass the Ramesh Raska from MIT?
Thank you for having here. I think at MIT, you know, you can blame us for being engineers, but every once in a while we can be, you know, culture. What do you say? Culture theorists. Wow, theorists. Wow, that's a tall order. We'll try. That's really a tall order to be culture theorists. But I think the you know, I'm glad we have Novartis and we have Accenture. You know, and I started the health innovation team at Facebook. And I think the point I really want to see how the panel thinks about is this notion that on one hand, the companies that have deep touch points, sometimes daily touch points, this could be telecom, banking, social media, internet companies, have a very deep role to play in thinking about digital health. On the other hand, companies that don't have a daily touch points but are very pervasive, such as, you know, pharma companies and hospital companies, have also a role to play. And when I was at Facebook, I think I realized that, you know, many of these health problems can actually be solved relatively quickly, but clearly many of these organizations either cannot or do not want to do this because it's not part of their mission, and they could be, you know, there could be a slap on their wrist. So I'm just wondering, you know, what can we do, putting on mostly an engineering hat and a bit of a culture hat on what we can do. So that's constantly on my mind as we move forward. Would love to hear your thoughts as well.
Thank you very much, Ramesh. And I want to turn now to a young AI entrepreneur in the room. Komal, you have co-founded an AI company which has built a product that's now used globally. And what's been your experience of what really scales, and how does the private sector work with public authorities, with foundations, and with communities in really changing the situation on the ground? What doesn't work for you?
Yeah, I think so. I mean, I completely second your thought on how the use cases of what you're building is very important. So I think we're right now doing a very large scale implementation in the Indian Patent Office. And I think when we understand what the system is looking for, it's easier to create use cases and create a product that actually works. And secondly, of course, partnerships, I totally agree, are difficult to handle. But I think if there's a lot of clarity and focus on what we are trying to achieve, and we're able to find use cases for the product, it works much better. And we're very excited to be a part of this project. And you know, whether it's cleaning of data or standardization or finding use cases, it'll be a pleasure to be a part of the team.
Thank you so much. And I want to now introduce Anir, who's just joined us. I had told you at the beginning that he's running late. I'm so glad, Anir, that you've been able to join us. Why don't you introduce yourself and then, you know, share some thoughts with us?
Maybe I'll introduce myself and then listen in for a little bit, if that's allowed.
Absolutely.
Just to get into the groove of things, I just ran from my previous session where I had to
just hold the mic closer so that...
My name is Anir Chaudhary. I run the Digital Transformation Program in Bangladesh. It's a whole-of-government program that I've been running for the last 13 years from the Prime Minister's office and also recently the Cabinet office. So I've done quite a bit of interesting things. Maybe I'll talk about them in a few minutes after I get a chance to hear from some of you. Thank you.
Thank you very much, Anir. So I want to open this up now to others in the audience who would like to contribute to the discussion, not just with regard to I-DAIR as a project, as a startup initiative, but also broadly on digital health, global public goods, and how the private sector and other actors can work better together to bring more inclusiveness into the SDGs space, to bring more transformative potential into the SDGs space, and not just tech solutions, but also partnerships around technology, with technology just providing us the excuse to bring more energy and new ways of thinking into solving our existing problems. So the floor is yours. And just briefly introduce yourselves, and yes, please.
Hi, my name is Ratan Bardwaj. This is a fascinating panel. I'm a pediatric neurosurgeon, so I'm a clinician. I'm also a stem cell biologist. And just hearing what you've mentioned, you know, as I'm coming here, I'm getting MRIs sent to me on my phone as I'm walking here. But global health-wise, cerebral palsy and ischemic events to the child's brain is a big problem. There are currently a few stem cell clinics that are pushing stem cell treatments. And I'm involved with a company trying to do a pan-North American kind of a trial with wearable devices using AI that's already been shown to see if we can affect and improve the health of children on a scale of not tens of hundreds, but of thousands in a meaningful way, just to say whether this technology works or doesn't, instead of taking money from, you know, parents who would do anything for their child in a bigger way. So we are using things like wearable devices, AI, global health, multinational companies with a very valid private partnership with a company. Is there any way using kind of what you're talking about, one could form a partnership for a valid project or a way to change systems of how we deal with a plastic brain in a small child with an insult?
Fantastic. That's very impressive work, and that's a critical area. So maybe at the end of the discussion today, you know, Martin, who looks after research collaboration, so we can have a word on how we can work together.
Maybe we
thank
take
you.
2-3 questions and then you answer
Yes.
the 3. Okay.
Hello, Andrew Jack from the Financial Times. And with the Lancet and the Botnar Foundation, amongst others, we're involved in a commission trying to look at AI and digital health and its impact, particularly on lower income countries and the most disadvantaged children and mothers. And just really interested, going to Anne's point about use cases. I just wonder if each of the panel could cite one or two of the products or services that are currently out there that either are already in lower and middle income countries starting to have an effect, or at least having an effect elsewhere and have high potential to be transferred into those most needed settings.
Thank you, Andrew. Yes, sir.
Hello, my name is Ash Damle. I'm a healthcare and AI entrepreneur. And one of the things I talk a lot with people is, what is the data plan? Fundamentally, AI, what makes it work or what does not make it work is data. Usually, especially in healthcare, it's terrible, terrible data. It's very dirty. And so one of the core things I would love to learn from people on the panel is, what are your thoughts about how you can create frameworks? And, you know, for just a simple example, the FDA, had they just made additional requirements, the ability to understand the true efficacy of medications and the comparative effectiveness would be dramatically increased, right? So just sort of, what are the ideas people have from the panel about how to support better data frameworks such that we can ensure good data, therefore providing the abilities for actually delivering AI? Thank you.
Thank you very much. Was there another question? So, let me turn back to the panel. So successful use cases and what's the data plan? We spoke about missing data. There's this aspect of misuse of data and the misuse of data, the 3 M's problem around data. So what's the plan to address those kind of issues?
So I'll just give a use case, which I find interesting because it affects me personally. So, I mean, as Anne mentioned, in the work that we've been doing for the Broadband Commission, we've been looking at a whole range of use cases around the world, and then really narrowing down to a few that we've delved into a bit more. So, and I know, just to say in terms of timing, that research report will be coming out in the May-June timeframe. But the one I pick is Babel, because, you know, that was actually the solution that was developed in Rwanda as an AI solution for people like you and I, right, to get digital health services, and the fact that it's been brought into the UK, right? So often we think, oh, well, you know, it must be a UK solution that we took to Rwanda. No, it's the other way around. But what I find fascinating about that is I was delighted when I got an email at work to say we have, as Accenture, you know, subscribed everyone to Babylon Health. You know, it's quite challenging to get a doctor's appointment in the UK if you're a busy working mother with 3 children. So actually I thought, you know, this is fantastic, right? So a real opportunity for people to be able to use that service. But then I was talking to a friend of mine who's a general practitioner in the UK, and he was telling me what a nightmare it was from his standpoint in running a doctor's practice about the impact on the operating model of that kind of system. The reason being is that the people that use Babylon Health is people like me who are actually quite low cost from the National Health Service perspective, but the elderly patients who are very expensive and they come all the time and they have very long appointments aren't going to use that kind of digital service. And so it really struck me that this wider context in which these digital solutions are being used needs to be considered a lot more. And it's not just, as we said, translating the technology, but thinking about the context and the wider impacts on how that service is having.
Excellent. Anne, please.
Yeah, I mentioned being a good doctor, and which is really the biggest one. But another one is that I really like a lot is the I-DAIR Health solution, where I-DAIR Health is a German startup which is providing virtual assistance to patients, how they can, for them to get diagnosed, even with rare diseases, and don't need to go to the clinic or get referred when they need to go to the clinic. And that solution is now being adapted to situations in Africa. It's even translated in Swahili, the first virtual assistant in Swahili, I think. So that's another very nice use case. It's also tens of millions of people already on that user base. But again, well, being a good doctor is a local solution, but I-DAIR Health comes from high-income country to low-income country. I, in fact, thought that Babylon came from the UK to Rwanda as well. But what I really feel strong about is that we also need to nurture the local ecosystem of local innovators, because they are working very isolated. We see a lot, we hear from all the entrepreneurs working on AI in East Africa, for example. We are going to work together with your colleagues from MIT and Harvard Global Health now in March, launching the first Data Science AI Summit in Rwanda, where we bring the Eastern African innovators together, where they can exchange how they can access their respective data and learn from each other, for example, to develop other solutions faster or learn from mistakes from others. And then look at what they need as what kind of research would be needed to help them further. So that's kind of another role we see very importantly for a foundation like us, that we also nurture that there's more innovation coming from locally, and then we can bring that to high-income countries. I believe a lot in reverse innovation. And then on the question on data, I really don't have the answer for you because it's too difficult. But to develop solutions for AI, we need 3 things. We need data, good quality data. We need huge computational power, and we need algorithms. Well, the 2 last things, the algorithms and the computational power, can very well come from another setting. But the data have to be local. And that is where countries have to really start investing in now. We need countries to take these decisions to digitize their data in systems that are interoperable instead of being faced with silos. All the data in most of the countries we work with sit in silos and they don't talk to each other, so you forget about coordinating care for patients. If a patient is seen in primary care and then goes to the hospital, those data don't circulate. So we need a new data deal, I believe. We need the patient to carry his own data. I really hope that that will come soon. I don't know how, but data is really the foundation for AI, and we know from my company, I know, for example, we've invested a huge amount of energy and money in making our data from all the clinical trials interoperable and cleaning them. It was an enormous investment, but at least now we sit on, I don't know how many million years of patient data, which can be used for further clinical trials and which will accelerate a lot. But it's really an undertaking that I don't think a lot of countries will have the energy for. So we have to start from a better basis, but I have no answer what the data deal should be.
But you gave us a great slogan. We need a new data deal. And it goes back to what Miranda was talking. We need to turn data over to individuals. Anita, I'll come back to you in the end so that you can have more of an opportunity to share your thoughts. Philip?
Yeah, so I'm going to try to answer three questions, right? So you mentioned partnerships with corporations. I think the thing is that, and I think we need a new model of partnerships. The partnerships currently are MOU and, kind of lock-in. I feel sometimes, and we in the council will talk about train sets, right? It's about onboarding and offboarding. I think partnerships also have to be agile. That's the kind of ecosystem I run, that you need to meet people where the incentive structure works for them. So it's not about working with Facebook. Maybe I need a very specific thing from Facebook. At the moment, for example, within our food systems ecosystem, Facebook is very good at working with farmers around information. So that's the only time we bring in Facebook. But we don't need them all the time because also they don't have time. So what we realize is that as a government is how do you create those buckets so that corporations see incentives, and this is where they need to put in their efforts. As public goods conversation, we're bringing in Google X for something else. They don't have to be everywhere. But then the other thing is just to be open enough to share the big picture so that they know they're contributing to a larger whole. In terms of data, I think for me, yes, government data, but also private sector data. I mean, let's be honest. Private sector has more data than we have. And beyond that data deal, I think we need to build more data collaboratives. I think the issue about data is trust. And so you can only win trust by collaborating. And this is what we've seen. So I think for me, that is what we need. So in our sense, for example, we put together a health data collaborative. As I said, 60% of our provision is private, right? Only public facilities contribute to the DHIS. We have no way to compel private sector to contribute to DHIS. So the only way you do this is collaborate so that they see the value of why we need their data within the larger system, and also they can have access to a larger pool. In terms of an innovation that we think has been working is not an innovation, but it's a set of innovations that are answering a larger problem. And for me, it's the Philips backpack, right? So Philips has a backpack that is solar, that is, it can be charged by solar, and has a multiple set of innovations within which community health workers can use to go to the last mile, which means they can go to a house. If it's a midwife, it can be customized so that they can send in birth records. Our civil registration and vital statistics data is horrible. But then we have midwives who are trusted and have that data. It has a GPS location. At the same time, it has a blood pressure measurement. At the same time, it can measure blood sugar. So it's, for me, that is what we found very interesting. And it's answering a larger need of health worker problems. Right, so for that, and again, responding to civil registration of vital statistics. So again, for me, it's not the innovation, it's a set of innovations that answer a larger need.
Excellent. Ani, you have the last word.
Thank you very much for allowing me to catch my breath also. So I'll go a little bit beyond data and talk about what we have been facing in digital. Oh, can you hear me? Yes. Okay. So what we have been trying to do in terms of digital health and also recently in terms of artificial intelligence. We've tried different things. We've tried to introduce telemedicine, so assisting doctors, because we have a huge case of doctor absenteeism in the rural areas. So assisting with urban doctors, collecting data there. It worked to some extent. We had a number of pilots done by the private sector and also by the government. But ultimately, we could not scale it up nationwide because we could not come up with the right business model. So that's one lesson that we learned. Recently, we're looking at malnutrition. So there is moderately acute malnutrition, there is severely acute malnutrition. And we're trying to make sure that the moderate does not become severe. And we have a lot of data that we are now analyzing and trying to see which patterns give us which kind of interventions, and actually working with the health workers in the rural areas to actually change their visit schedule for pregnant mothers and things like that. So that's something that shows a lot more promise than the telemedicine experiment that we did. And what you talked about, the backpacks with different kits, we tried that as well. We actually tried foreign ones, we tried locally developed ones. Again, the business model could not be developed. So that's one lesson. Data comes in from many sources in Bangladesh. The public source is the DHIS. The DHIS2, it's the largest implementation of DHIS in the world. 14,000 community clinics actually pump in data every single day into the DHIS model. We have data being captured by CRVS. So that's a different ministry, local government ministry, that captures civil registration data that currently does not interoperate with health data. So they're two different islands. We tried a mechanism recently where we had the health workers collect the civil registration data and send them to the registrar. So in that location of the country, we saw civil registration went up, going up from 1.4% within 45 days to 95% within a matter of 2 years. So now we're trying to explore the possibility with Gavi of introducing a child biometric during vaccination, because Bangladesh has a fairly good coverage of vaccination, 98%. So we are trying to catch those events where we introduce child biometric. We have caution from many organizations, including UNICEF, about how child biometric will be used, but if it can be used properly with privacy ensured, then we can actually increase civil registration rate significantly, and also develop an ID, a digital health ID that will last throughout lifetime, we think. We're facing several challenges. One is the data sources. They are fragmented. They're large, but they're fragmented. We don't have access to private sector data. As you said, 60% of our population actually goes to the private sector for health coverage. And a lot of these are actually informal. These rural clinics, which obviously don't capture data, even hospitals in the sub-districts don't retain data. So how we regulate that is an open question. But we do need that data. We need that data in a specific format. So that's one important policy issue that we're grappling with. Second is the doctors. They are not very willing to spend time on technology because they have other things to do. They have no time to see patients. So data capture takes time. So how we get our doctors, and we don't even have nurses. We have 1 nurse per 10,000 patients, 3 doctors per 10,000 patients. So the nurse-doctor ratio is also completely flipped. So we can't even have the nurses capture this data. So how do we actually capture data? If we have the digital health ID working properly, then that would actually allow us to capture data more quickly possibly. So those are some of the things that we're dealing with right now. The last thing I want to mention is that there are a lot of startup companies, including larger telcos, which are supporting different experimentation. But in the absence of a legal and policy framework, many of these experiments just remain so local that they don't have have a fighting chance of ever making it into scale. So do we do policy regulation first and provide the right support, or do we actually straitjacket all this experimentation? We don't know that. So that's where I think the global dialogue, such as this, which I completely missed, so again, apologies. Hopefully we'll get some of that after the discussion. So it will be very helpful for us. So I'm sure we're struggling with similar challenges in different countries, developing countries. So I'd like to learn from your solutions and also present my solution that as we develop them. Thank you very much.
Thank you so much, Anir. Please join me in thanking our fantastic panel. Thank you very much. And thank you to all of you for finding the time. The Davos calendar, I know, is is full of exciting events and opportunities. So thank you for being here. And please also join us for an aperitif, for some drinks at the back of the room. And I wish you all a great stay at Davos this week. Thank you.